What makes this lab, or the Crabb lab, unique is that we're in an optometry department and we have researchers who are optometrists, but we have a mixture of different researchers. So we have computer scientists, mathematicians, psychologists, and we even have a health economist as well. And this means that we're interested in a variety of topics, but all of those topics really fall under the broad umbrella of measurement techniques in vision. There's at least 4 different kinds of themes that we're interested in. We're very much interested in imaging and image processing, and some of the new imaging devices such as optical coherence tomography, and developing software that clinicians can use to better manage patients with those instruments. We have a long-standing interest in measuring visual function. Another strand of our work is we're very much interested in what happens in the eye clinics, in NHS eye clinics, and there we look at large-scale data in order to assess how good we are at health service delivery. And then the other theme of work is really trying to relate all these measurements to what people can actually do in everyday life in terms of their vision. So we do a lot of studies here where we measure visual performance in things like face recognition, but then we also have skills where we can analyse and interpret that data, and that's where the statisticians and computer scientists become involved.
So in the Crabb lab, we really try to directly engage with patients in our research, and there's over 1 million patients being treated for glaucoma every year in the NHS.
The visual field tests are very interesting. They are obviously very important, but the choreography of the test is challenging because the patient gets very fatigued over the duration of the test, and because there isn't really a break between the 2 eyes. So invariably the second eye suffers.
Together with Carol, we planned and authored some research on the health services delivery of glaucoma monitoring, which resulted in several papers on visual field accuracy, testing and progression, and led us to making some useful software for the clinic staff. So Carol also took part in some qualitative research that we did where we asked patients what they really thought about their experiences of the glaucoma monitoring process.
First eye, you're more alert, you're more conscious, you're more up for the test. By the time you get to the second eye, you just want the test to be over. And it can be quite distracting being in a room where there's other noise, there are other patients doing the same thing, you can hear the beeping going on the whole time, the technicians are talking to each other. It can be very irritating, so it's quite difficult sometimes to concentrate, and you can feel your concentration going, so it's not wholly successful for the patient.
From the analysis of the results, we were able to make some suggestions for clinicians and support staff, such as explaining the test to the patient, making sure the tests were well supervised, and improving the testing environment. It was also suggested that this be combined with the progression analysis research we did, so the patients only had to do the tests when absolutely necessary.
We did a study where we first of all interviewed patients about how they perceive their visual loss. With this eye disease, glaucoma, the received wisdom is that when people have advanced vision loss with glaucoma, that they go around the world looking through a tunnel. But what our research showed is that patients don't perceive their vision loss in that way. And then we were in the happy position of translating those results into the form of some patient information. And this led us to develop an app that patients and their families can use to kind of get a better idea about the very subtle symptoms of vision loss that affects that particular eye disease. The app that we've developed is called Glaucoma in Perspective, and it's available on iPad and Android, and it's something that's really useful for patients and their families to find out a little bit more about how these patients perceive the world.
We have a few different sections of the app. We've got Tell Me About Glaucoma, and each of these sections has information about glaucoma. So we also have a section demonstrating what it might look like to have glaucoma from a patient's perspective, and we can select one of a number of different scenarios, and we can draw on where the patient's visual field loss is. So we can see that if we just draw the loss on one side, because the patient's other eye is compensating, they can still sort of see things in that area. But then if they lose their visual field on the other side as well, things start to disappear. So the kettle there disappeared. We can also look at an example visual field and what might happen if glaucoma goes untreated in this patient.
What we always try to do with our research is to try to translate it into something that the clinicians can use. That's always very difficult to do, and it's a difficult process to come up with an idea and then see how that might then translate into clinical practice. So those little things, when you see like a research idea, turn into something that's practical and useful from a personal point of view, is really very pleasing.